People call this an epidemic, a global epidemic. And some people would say that's an overly liberal use of the term epidemic. But if we look at an epidemic as something being rapidly increasing in number, I think it truly is an epidemic. And it's an epidemic that's so sad because so many people are becoming ill with a condition that in many cases, not all obviously, many cases is avoidable, but it's also a potential economic disaster. And I can tell you that health ministers and governments around the world are incredibly intimidated and overwhelmed by what they see, because more and more healthcare dollars are being spent to help people living with diabetes, to the point that it could basically usurp the budgets that are allocated for everything else. But as a physician, I don't think of it primarily in terms of macroeconomics or even microeconomics. I look at it in terms of the person that sits beside me in the office who has a serious disease, and I need to help them, because diabetes is incredibly treatable, and people can live a full, active, healthy life with it. So the statistics, Lianne, that you were alluding to before talk about the increasing prevalence of diabetes around the world. So I think it's important, by way of background, if you don't mind, for me to just explain a little bit about diabetes, just so people really know we have a common, we're on the same page. Mm-hmm. So there's two types of diabetes. The one that most people are aware of over the years, the type like, Mary Tyler Moore had, or Bobby Clark, the hockey player, Nick Jonas, the famous rock singer in the U.S. So these are, people got it as kids. It's called type 1 diabetes, which tends to come on somewhere between the ages of 8 and 16, although it can occur younger and older. And people with type 1 diabetes need to be on insulin right away, like within days, otherwise they could even die. But when we look at, and that type of diabetes is increasing in number, but the type that really we're looking at in terms of the global explosion of diabetes is type 2 diabetes. Type 2 diabetes tends to occur in middle-aged or older people, typically, but not always, in people that are overweight and sedentary. So the statistic you were alluding to before was talking about this global epidemic of type 2 diabetes. And so the question, of course, that we all ask is, well, why? Like, why would a disease that 100 years ago we seldom saw, type 2 diabetes that is, why is this now a veritable explosion in numbers? And the reason seems to be related to lifestyle. So, living in the developed world, in the West, we export a lot of things that people value, trust, and need. But one of the things we export that people don't value and certainly don't need is our lifestyle. Because as we all know, in Western society, we tend to be more sedentary and certainly more overweight than we used to be. And these are things which we have, unfortunately, moved into the developing world. So if you look at obesity rates and rates of sedentariness, that has gone up everywhere, Asia, Africa, everywhere. So that's probably the background behind that. But the thing is, there are things we can do to change that. It's not easy, though. If I'm trying to look after a patient sitting beside me who has diabetes, that's challenging in itself. But the idea of trying to transform society as a whole, obviously that's a lot more than any individual doctor can do. That's a societal issue.
Yeah, I was just going to say, what common thread do you see in your patients, especially children who are being diagnosed with type 2? What common thread are you seeing in terms of their lifestyle, etc.?
Well, it's not so much my own personal practice because I'm an adult diabetes specialist, not a pediatrician. Mm-hmm. But I can tell you what my colleagues see and around the world. And that is that children who used to be busy running around the schoolyard and were slim and fit and playing soccer and football and hockey, lots of kids do that, tons of kids do that, but more and more kids are actually not engaged in that type of physical activity. They're playing on their computer for many hours a day and are overweight. And it's especially a problem in people from certain high-risk communities, like in the southern U.S., for example, where they have a large Hispanic population. The rates of obesity in that population are huge. In First Nations communities, it's a problem. But I wouldn't want to pretend for a second it doesn't affect all communities, because it does. So one of the saddest things about this, number one, is it's preventable. It doesn't have to happen. And it's such a shame. I think it's so sad when children are getting sick from a lifestyle disease that used to be confined to adults. I mean, you know, I have 3 children. The idea of my children being sick or ill, I mean, it's horrifying. And so it's very sad. But, you know, I can show you, maybe you won't find it interesting or maybe you will, but although this was presented as new data, this is something that in the medical community we've been talking about for a number of years. And in fact, I've presented on this topic around the world, really. But let me show you a few things which you might find of interest. So a few years ago, there was an article came out, probably the world's most famous medical journal is the New England Journal of Medicine. And there was an article there which I looked at it in disbelief. And it you know, as a medical professional, most articles I read pretty dispassionately. But when I saw this, it just really got to me on an emotional level. Like, not to sound sucky about it, but it was really upsetting. So I don't know how clear that comes out. You can let me know can you see that all right?
I can. A potential decline in life expectancy in the United States in the 21st century.
I mean, that's unbelievable. Like, nowhere, so I'm not a historian, but so far as I'm aware, nowhere in history has there been a time that we looked at our children's generation and said, oh my goodness, as a generation, they may live shorter life expectancies than us. I mean, any of us that are parents, we want our kids to be healthy and happy and live longer and fuller lives. And I think that was so sad. And there was a follow-up. So that was in a medical journal. But obviously the press saw that, thank goodness. And so I'll show you a headline from the New York Times that really captured the world's attention. And again, you can let me know if you can see that all right.
I don't see I just see the New York Times.
Okay. Well, that's a good start anyways. So I'll read it to you. It's one sentence long. And it's dated March 16th from Boston. And it says, for the first time in 2 centuries, the current generation of children in America may have shorter life expectancies than their parents. I mean, that's so sad. And, you know, so why? So it's because our children as a whole, I don't mean your children or my children necessarily, hopefully not, but our children as a whole in society are more sedentary, more likely to be overweight or even obese or even severely obese. That in turn can lead to a whole bunch of different health issues, diabetes, high blood pressure, high cholesterol, heart disease, and that could lead to premature death in a generation of children. I mean, I know I said it's a tragedy a few times, but it really is. So I keep looking at how to make that message impactful when I talk to a lot of lay audiences, and I keep thinking, how can I make that impactful? And then I saw this statistic. Now, you know what they say about lies, damn lies, and statistics, right? Mm-hmm. But I saw this statistic graphed, which I think illustrates it really well. So, you know, I mean, you're a reporter, so you're familiar with relative risk. Mm-hmm. So we hear all the time, Lianne, about something increasing the risk, doubles the risk, and it's a headline. Or, oh my goodness, such and such a product might triple your risk of some bad thing happening. And that's meaningful. But then I saw this statistic looking at the risk of diabetes related to your weight. So hopefully you can see this graph because it's one of the most overwhelming statistics and I think it's so demonstrative that anybody, whether they're in elementary school, high school, or a Nobel laureate, can relate to this. So let me know can you see that, even if you don't see the numbers, which I'll explain, but can you see that exponential curve heading up to the right?
I can.
No, yeah. Not showing?
Yes, I can. It's quite steep.
It's quite steep. Mm-hmm. But not only is it steep, what it tells us is if someone is severely overweight, not that the risk of diabetes goes up by 100%, which would be huge, or 200 or 300%. If someone is severely overweight, the risk of diabetes goes up by 9,000%. 9,000%.
That's incredible.
So I keep thinking, with that incredible risk, why isn't that capturing everybody's attention as a potential healthcare disaster?